Hello, once again. It is my pleasure to welcome two incredible speakers to our closing session, The Importance of a Family-Centered Care Approach in All NICUs. Our speakers this afternoon are members of the Family-Centered Care Taskforce and work tirelessly to help NICUs strengthen family-centered care approaches in their units. Dr. Malathi Balasundaram, fondly called Dr. B, is a clinical professor, Stanford University El Camino Health neonatologist, and the founder of the Family Centered Care Task Force. Through a national survey, she noticed a need to bring family centered care from research to the bedside. So she recruited passionate healthcare professionals and family partners and formed the task force while still working as a full-time neonatologist. Keira Sorrells is the founder and executive director of the NICU Parent Network and family partner co-chair of the Family Centered Care Task Force. Keira is passionate about positioning parents as key contributors to research, standards of care, and family support. She believes that parents, especially those in the NICU, are crucial informants for improving healthcare practices. Please help me welcome Dr. B and Keira for this insightful conversation. Welcome, ladies.
Thanks so much for having us, Kelly.
Thank you for having us, Kelly. I'm so honored to be here.
Looking forward to all you have to share. And with that, I want to take myself off camera and let y'all get started. Thank you.
Okay. Thanks, Kelly. Well, thank you so much again. And as Kelly said, I'm Keira Sorrells, and I am here with Dr. Malathi Balasundaram, and we are going to be talking to you today about the importance of a family-centered care approach in all NICUs. These are our disclosures. And by the end of today, we hope that you will understand the importance of family-centered care, that you will be able to identify barriers to implementing FCC in the NICU, and really, I think most importantly, be able to know how to ensure that you're getting it right. When they told me that I was going to deliver my triplets at 25 weeks, 5 days, I went completely numb. They told me I'd be lucky if just one of them survived the delivery, and I would be luckier still if we actually got to take one of them home after what was definitely going to be a lengthy NICU stay. Well, all three did survive. As you can see here, we have Avery in the top right and Lily at the bottom right and Zoe there on the left. But after they were born, I refused to go see them for 2 days. My husband would bring me these Polaroid photos. This was 18 years ago. So we didn't have the cell phone photos like we do now. And the nurses would take these photos and they'd write, hi, mom, on the back of it with their name. And I would look at these kind of grainy images, and all I would think about was what a failure I was. And I would think, what kind of mother has to turn the back of the picture over to know which baby she's looking at? How could I even claim to be a mom if I didn't even know my own children? And I would just kind of lay in my hospital bed. I was overcome with shock. I felt like I'd been hit by a Mack truck because of that mag wash, and I just berated myself. Why did I go and mess with nature and pursue fertility treatments? Why didn't I just accept that I wasn't supposed to have my own children? This is my fault. I did this. And I thought, I'm being punished because of these fertility treatments. During that time, I did make the choice to reduce my pregnancy from quintuplets to triplets. And now my little girls were suffering because of what I did. And this was not guilt. This was shame. This wasn't just, I did this. This was who I am. I was selfish. I was worthless. I was a failure at getting pregnant and a failure at staying pregnant. So how could I even claim this role of mother when I finally did see my babies and I felt nothing? I was just blank. completely empty. And I wondered, where is this bond that I heard of? Where is this instant love and connection that I'm supposed to feel? And why couldn't I just conjure it up? Why wasn't it there? And I remember one evening when my husband was crying in his own mother's arms because Lily was having a particularly rough night. Why did I have to force myself to shed even a single tear? How could I claim to be a mother when I just felt so hollow? This kind of sense of worthlessness would morph over time into hypervigilance and generalized anxiety disorder. And I would just wait for the other shoe to drop at any given moment. We've often heard of the NICU experience being like a roller coaster. And when a family has multiples, those roller coasters are never going up and down at the same time. One of our babies would be soaring and then the other would bottom out. I'd struggle with these feelings of happiness that when one of our babies finally took their first feed, and then this guilt because Zoe was still on the oscillator, and then Avery still hadn't been able to wean off her blood pressure medications. And it was this dichotomy of emotions, that intermingled kind of dance of joy and grief, that it was almost impossible for me to reconcile as I moved through our days and our sleepless nights. And my husband and I were simply off balance in every way. We grappled with expecting the unexpected and fearing what that might be. And when our babies were about 4 weeks old, I remember sitting in the rocker next to Zoe's isolette and just was feeling particularly unsettled. And my mother had been encouraging me to try and celebrate their arrival and send out these birth announcements. And at the time, I was an interior designer. And so I spent weeks picking out the absolute perfect birth announcement for my girls. It had this kind of antique blush background and this vellum overlay and a beautiful satin bow. And, these were going to be perfect. They were special because this pregnancy was special until it wasn't. And my mother's words just kind of hung over me. She said, Keira, your babies are beautiful. They're here. You need to let everybody know. And the only thing I could think of was, I'm not sending anything out until I know whether or not I have to send a funeral announcement with it. That fear of the death of my children, and Zoe in particular, because she just really struggled the most out of all of them from day one. It created this really significant barrier in my ability to bond with them. And the thought of losing her and the thought of the pain that I would experience if I loved her was more than I could bear. And so as I'm sitting there this one day, the neonatologist came up and I just point blank asked him, I said, should I be planning a funeral? And he looked at me. He's normally, was very stoic, kind of no nonsense kind of guy. And he said, don't lose hope. There's always hope. The NICU is a very unnatural place to be a parent. And the emotional climate of the NICU for me bred self-loathing, depression, anxiety, PTSD. It's like where these weeds of shame just kind of grow and can just choke the life out of you. But when that climate is cultivated, when it's properly tended to and supported, the richness of healing can overpower the shame and the fear. And it can become, as it was for me, where the journey to healing would begin, and where I would begin to really discover who I am, not just as a mother, but as a woman, as a wife, as a friend. And it began in the NICU. And this was 18 years ago, and they embraced family-centered care. We were finally home, all under one roof, after 291 days. Avery and Lily, who are in the Furman and University of Georgia onesies on the left and middle, they came home after 4 months, but Zoe needed to extend her stay by about 5.5 additional months. Unfortunately, her stay at home was very brief. She was rehospitalized shortly after their first birthday and died within 24 hours of readmission. Her death certificate listed influenza A and B, sepsis, irreversible shock, BPD, pneumonia, and complications of prematurity as her causes of death. And as with many parents who go through a NICU experience or a loss, the lens through which I saw life in general changed completely. And I felt this urgency to do something that was just unavoidable. So we started a local nonprofit to help families. I started to get involved in advocacy work for maternal infant health and got invited to speak at the CDC one time about the burden of RSV. And I remember after my 3-minute public comment portion in front of all these really highly educated scientists and researchers and physicians and regulators, I sat down and I thought, why would they even listen to me? You know, I'm one mom from a tiny organization no one has ever heard about. Did what I say even matter? Did they hear it? But what if I had a room full of parents standing with me? What if we shared a common vision and a common voice about the physical, emotional, mental, and spiritual toll of a NICU stay or a loss on families? Because I was one, but we all know this is a picture of a bunch of people because we know that over 300,000 babies are born preterm every year. And that's just preterm. That doesn't include the full term babies that are admitted to the NICU and the babies who die. So I knew I was not the only parent out there that was experiencing this trauma and feeling motivated to do something. You know, in some ways, I found my newfound path to heal. But it wasn't exactly the right way to go about it because I used the busyness of building an organization to avoid dealing with my trauma. While there certainly have been people that were helped during this time, I believe that my own healing was stunted because I was so concerned with other people feeling better that I ignored what was happening to me. And you would kind of see all these great things on the surface, right? But the depth of what I was experiencing inside was unmistakable. And there was a time when I was doing bedside support and a family lost their baby, a 24-weeker, and I went to the funeral. It was the first funeral I had been to, and for a child other than my own, and I couldn't get out of bed for 2 more weeks after that, and I knew that something had to change, and so I did. I got help from a maternal mental health psychiatrist. I had a grief counselor. I got medication. I had a peer support specialist. I joined a Bible study and just began to face what I had been through and began to face the shame that really dated back to my fertility treatments. And with time and consistent help from that support network that I kind of gathered around myself, I was able to release that shame and I was able to kind of rise from the ashes. And at the same time, I knew that it was time to let go of the Zoe Rose Memorial Foundation, which was that small organization we started, because it wasn't about me and Zoe anymore. It was about all of the NICU families who face the trauma of a NICU stay or a loss. And I didn't need to leave a legacy for my daughter because her legacy lives inside of my heart and the hearts of my family. And that's the only legacy that she needs. So we started the Preemie Parent Alliance and in 2019 changed the name to the NICU Parent Network to ensure that our organization was a place where all parent advocates, regardless of what brought them to the NICU, felt welcomed and included. And together, our network of 45 community-based NICU family support organizations support over 200,000 NICU and bereaved families every single year. And I am so proud that Kelly and Hand to Hold have been founding members of NPN literally since day one, way back in 2010. And throughout this work, about 3 years ago, I learned about the Family Centered Taskforce. And I saw this as an even broader opportunity for families and healthcare providers to really work to improve the lives of NICU families. So I think it was after a webinar, I emailed Malathi and asked if I could join the leadership team. I just stepped right in there and she graciously accepted. And it's been an incredibly inspiring experience to work alongside her. And I'm just really excited about everything that we have to share with you in these next few minutes that we have together about how you really can and should partner with families to make meaningful change in healthcare. So we're going to start off with a poll. If you did not get a chance to answer this poll before the session, we'll give you just a second to click on over to your polls button and give you just a few minutes to go ahead and answer that if you haven't already. And then we'll share those results in just a second. Let's see. But we have 240 responses, so that's pretty amazing. So right now it looks like we've got some people adding in. So I'll give you just a few more seconds. Okay, it's kind of slowed down there. So out of 253, 191 of you currently work in the NICU, and then 62 do not. And then as far as your role is concerned, if you didn't see that one, go ahead and pop to that poll and let us know what your role is. All right, that one looks like it's kind of stopped. Oh, there we go, a couple more. All right, looks like we've got 232 answers. 151 are healthcare professionals, 28 are NICU parents, 29 are both, and 23 noted other. So I'm just really excited with all we have to share, and I am going to pass things over to Malathi now so we can hear and learn more about her personally and how she came to be in this position of starting the FCC task force.
Thank you, Keira. Thank you for everyone joining here. I know everyone has a busy schedule, and thank you for being here and being part of the FCC Advocate, and thank you. Thank you, Keira, for sharing your children with us and your advocacy work, and it's so powerful, and this trauma lingers with NICU parents forever, and even after 18 years, and it's still, I can hear the voices of that trauma from you. Thank you for sharing, and thank you for with so many great parents like you and others. I'm glad you reached out to me, and I'm honored to have you as one of the FCC Task Force co-chairs. I grew up in a small town in southern part of India called Kanchipuram, a city of 1,000 temples. What you see is one of the temples built in 700 CE. Next slide. My dad owned a small provision store. I think it's called Mom and Pop in US. I vividly remember doing schoolwork in between attending to the customers. My dad bought this wholesale cookie packs, put them in a glass container, and sold them individually. No one buys broken cookies, so you have to making sure it's not broken and it's full and you can sell those cookies. My brothers and I prayed to have many broken cookies so my dad would give them to us so we could eat them. But we did not know the consequences as it would affect our earnings and income. I tell these stories to my kids so they can understand and see where their moms came from and appreciate what they have in their privileged lives. Next slide. Oh, next. I was the first girl in my family to attend college, and that too medical school with a scholarship. Growing up in a low resource setting made me an empathetic and compassionate caregiver. I am a minority immigrant woman and a person of color. My journey has been one of overcoming challenges and seizing opportunities to find my passion. I joined the Stanford Neonatology Group in 2015 after completing a fellowship at UCSD. And all of my FCC work passion started at El Camino Health, a level 3 community NICU. Next slide. On October 18th, 2017, my first year after joining the FCC committee, we had our Family Advisory Council meeting. Imagine a room full of NICU families collaborating with a couple of healthcare professionals. They shared their feedback. Some were positive, some were thought-provoking, and some didn't occur to me at all. One mom shared how she felt someone whisked her baby away after delivery and wondered for a couple of hours that she lost her baby and baby had passed away. One mom shared how she had hopes and dreams about her baby since she found out that she was pregnant. And it all collapsed when we gave statistics about her baby's survival. Does she want to know? Have we asked them? We clinicians show up to work, but the experience could be more different for parents. As one NICU parent said, she was a key note speaker of today's talk, we are not showing up to work, we are showing up to trauma and fear. Next slide. Hearing so many stories changed how I practice medicine. I intentionally engage with families, putting families at ease, reducing anxiety, less pain, and more joy. Keira clearly states in this slide, family-centered care is about being human to another human. It is relating to a family who is suffering and rallying around them to mitigate their suffering. How do we do this? Only by implementing family-centered care and following its 4 core concepts: information sharing, providing dignity and respect to families, encourage their participation in their infants' care, and collaboration with families. Next slide. It's not from me or one parent. Several esteemed organizations support FCC. American Academy of Pediatrics put together a statement about FCC definition in 2012 and reconfirmed in 2018 that it is grounded in a mutually beneficial partnership among patients, families, and providers. Next slide. The same organization published standards for levels of NICU care last year, in which included FCC as a general program requirements for NICUs. Some are core components, such as allow all parents to have access to their infants at all times, and process to do social determinants of health screening and mental health screening, and refer them to appropriate resources. And some are listed as additional best practices, which are on this slide. Are we truly practicing this? That's the question we wanted to handle in FCC task force. This slide, if you have followed the news, recently several hospitals shared their ranking proudly. The US News and World Report includes several aspects of FCC practices. I'm not sure how it gets reported, if it is in the form of checkbox or not, or if any parental voices included or not. There might be an opportunity for family advocates to share their voices to include in this report. Next slide. Not only national organizations support FCC, WHO released a guideline in 2022 after reviewing 200 publications related to FCC and shared in the report what matters to families. What matters to families is to be involved in infants' care and to take an active role in deciding what interventions are given to their baby. Next slide. What you see here is the screenshot of the WHO guideline. A is the preventive and promotive care, and kangaroo mother care is on the top. It's a preventive and promotive care. And then second B is the care for complications, that's medical management. And then next to that is the C, family involvement and support. Next slide. When we expand further family involvement and support section, they have listed the recommendation strength, strong to conditional to good practice. Involving families in their infant's care, which is FCC, is the strong recommendation. Why? Because there are several benefits of FCC, and Keira will elaborate what are the benefits of FCC in the next slide.
Thank you, Malathi. Pardon me. One of the things that Malathi opened, I don't know if it was a meeting or a webinar, could have been one of our executive council meetings that we had for the task force. And she said there are over 15,000 publications in relation to family-centered care, all the way back to 1953. And I can't remember which of the nurses who's also a NICU mom said in the last session, but it was, something to the effect of, why are we still talking about why this is important? We know this is important. Some of those reasons that we know this is important. Sorry, I just muted myself for a second. Is that having that parent present is really the cornerstone of family-centered care. It's not something that's nice to have. It is a critical component in providing the best possible care for babies. We have improved bonding and attachment, which we know are crucial for infants' medical, emotional, cognitive, and psychological development. And we also, of course, see evidence of reduced readmission rates, improved weight gain, and shorter hospital stays. But of course, as the name implies, it's not just for the babies, it's for the whole family. And so I think we wanted to ask a question here that you can just put in the chat. I see we've got a lot of comments going on, which is great. Is if you were in a unit that was family-centered, so this is a question for any parents that we have, how did you know that this was the care that you were getting? In my experience, I couldn't name what we were experiencing throughout our stay until I got into advocacy work and I learned, okay, there's this concept called family-centered care. It wasn't like it was plastered across the walls in the NICU. It was the actions of the staff. It was the way they facilitated bonding. It was the way they gave me anticipatory guidance by setting up lactation appointments for me or calling OTPT to teach me infant massage, having regular care. It was receiving this hands-on learning under the guidance of NICU staff is what provides nurturance that supports and empowers the parents to establish their role. And it is critical to participate in decision-making and develop those necessary skills to care for their baby throughout the hospitalization and after discharge. We see that parental stress is reduced, which obviously leads to improved bonding experiences, improved breastfeeding, and that increased confidence, not just in the NICU, but also after the NICU. And as you guys are sharing some of your comments, pardon me, I want to share another little story during my experience, because this was Zoe who stayed a lot longer, like I said earlier, and we were in the NICU, which was very family-centered. And then at one point we did get transferred to a children's hospital, and the differences were night and day. So just a little context for this photo. This is Zoe, and she had spent a few days at that children's hospital getting fitted for hearing aids and getting her G-tube placed. And I'll just say that they could have used some training. But this picture was taken when we got transferred back to our birthing hospital NICU. And the nurse had the room all made and set. There were colorful linens on the crib mattress. A welcome back Zoe sign was on the whiteboard. The lights were kind of turned down. And you can just see in Zoe's face, you see that she feels that. She feels that calm and that contentment. in this photo. It's like she knew that she was back where people were really going to care for her. FCC, it matters. As a parent, you may not know what to call it when you're in the midst of your NICU stay, but it is evident when it exists and also evident when it does not exist. We have this quote from our president-elect at NPN, which I thought was just really a beautiful quote, where she says, "There's no better feeling than holding your baby for the first time. Uninterrupted parental presence in the NICU allows for more moments like these, which are beneficial to families and babies." And again, we just really feel that this is the center of family-centered care, where you have the nurse and the parent partnering to care for the baby and care for the family. And I shouldn't just say nurse, I should say healthcare partners. So going back to our poll area, we did have a question here for the parents about that first hold. So for all NICU parents, please share your experience holding your NICU baby for the first time. And I'd love for you guys to go ahead and populate that. And as you do, I'm going to share some of these that were already put into the poll. I was nervous, scared, excited, desperately wanting to feel connected because I didn't. It was 2 weeks after birth and truly improved my son's prognosis. No one offered for me to hold my baby, so I didn't know that I could. Someone else asked for me. I will never forget the feeling of my twins being placed on me. I felt so whole. Terrifying and exhilarating, mix of finally and already. This was 11 days after birth. Magical, terrifying, the greatest moment and most heartbreaking all at once. We got to hold him 10 hours after birth. He was born at 29 weeks. He was placed skin to skin for a couple of minutes before he was taken to the warmer bed, 32-weeker. Overwhelming moment, fearful, peaceful, literally changed my life. I mean, I can't wait to share all of these with you because it's really very impactful to hear these words exactly from the families. And it's not just good for the families, it's good for the staff. FCC is proven to be helpful and supportive for staff. We recognize that learning new ways of delivering care can feel too big sometimes. It can feel overwhelming, but studies have shown clear benefits in more meaningful work, improved job satisfaction, feelings of accomplishment. So I'm going to have you go back to the poll again for our healthcare professionals and answer that question. For all NICU healthcare professionals, please share, how do you feel when you deliver FCC to your NICU families? So as you answer that, I'm going to do the same thing and just share some of these that are already in here. It's difficult when the baby is critical, rewarding when we're able to care for and involve the family. There's so much I can't help with, so I feel good when I can alleviate a stressor for a family. It's a privilege to be able to take care of the babies and families I encounter every day, like I'm doing what's best for the baby. This is my job. I love it. Struggled with balancing FCC and family-directed care. We are providing the highest level of care and what each baby and family deserves. I feel successful, profound, great, accomplished, amazing, like I'm giving complete care, like it makes a difference. But then we also have some that said traumatizing, powerless. So there's a mix here. Oh, we've already done that one. So when family-centered care is not implemented, there can be a lot of breakdown. We will see that there's a lack of trust. It's a clear barrier to effective communications and things that Mia touched on earlier. We see that there's fewer opportunities for skin-to-skin care. And we know that these opportunities affect the baby's brain, and the babies have one brain for their entire lives. When families feel like they're bystanders rather than truly caregivers, this really does feed into the mental health issues that can arise and may be exacerbated. Parents feel incompetent and inadequate. They may not understand their baby's diagnosis or condition, which again can lead to heightened anxiety. And they also can feel unprepared to take a medically fragile baby home. I'm going to turn it back over to Malathi, who is now going to be talking us through some of these barriers that have been discussed within the task force.
Thank you, Keira. We're not saying it's easy to implement. I just wanted to put it out there. Yes, it is difficult, but that's the right thing to do. That should be a standard of care. So how do we get there? That's why we are having this conversation. So what we did in the FCC task force, so I'm going to elaborate what we do. And before that, I just wanted to share this slide. So we asked the centers, and what are the barriers in forming FCC committees? This is the quality improvement Pareto chart, and the x-axis is the barriers that listed, and then you can see the top barriers listed was a lack of staff time, and the next is the need for a culture change. And so we asked the centers their barriers and worked on their barriers and how to overcome on those barriers. And we did a small quality improvement work, and I will share in a few seconds. So understanding what are the needs and how to overcome, that's what we are tackling at the task force level. Next slide. So in my local NICU, so we figured out how to overcome the challenges, and we're still not perfect. And we adopted a comprehensive family-centered care program model to support NICU families from antepartum to NICU and beyond, starting with the staff education, peer-to-peer support, and mental health support, and family-centered developmental care. And we created a post-discharge follow-up phone call and also developed a palliative care and bereavement team. So with this structured, and it's not an overnight event, so it took 7 years for us to get to this phase of developing this comprehensive program. Here, next slide, Keira, from all our whoever is joined here, if you work in the NICU, please share if your NICU have a group or committee that oversees the FCC activities. Some of you already mentioned that you have a committee or you don't have. If you haven't get a chance to answer the poll, please take a few minutes to answer that poll, then I can share the responses over here. We got 194 responses. So it's still coming in. So I'll give a few more seconds. So 195. So 81 centers, you have already some committee, family-centered care committee or group, and 67 centers, they don't have one, and 46, they are not sure if they have one or not. So next slide, Keira. It's actually aligned with what I found in 2021. And if your NICU did not have FCC committee, you are not alone. When I initiated this national survey in 2021, 31 out of 48 NICUs did not have one, which led me to start the Family-Centered Care Taskforce to replicate our local NICU FCC work. Even if I can help one more centers to form the FCC program similar to our centers, that's a success in my mind. That's the goal of starting this task force in 2021. Next slide. So the FCC task force is changing the healthcare. It's a first international multi-center collaborative initiative solely dedicated to quality improvement in NICU family-centered care. Next slide. So we started with 50 members in February 2022, and in almost 3 years expanded to 1,700 who want to make a difference. So they joined and passionate FCC advocate, and from 48 out of 50 states and 8 out of 10 Canadian province, and from 57 countries. The listserv is monitored, and it requires approval to post. So please join the task force. So encourage your unit staffs to join. So we don't overwhelm you with emails. I promise that, because we don't want it to have additional email fatigue in addition to what we work in the NICU. So join the task force. So that's the one call to action. We are asking you to do it. So I will share why you need to do it and what are the benefits. Next slide, Keira. By joining the task force, you and your team could be part of this learning community. So we have a large group theme webinar. It's organized bi-monthly, and so far we have completed 16 free educational webinars. Each webinar features one healthcare professionals and one family partner. All are recorded and available free on our website. The next one is on November 14th, next Thursday. A neonatologist from Israel will share how the task force supported him in establishing family-centered care program in his NICU and his efforts in sustaining FCC practices in his unit, especially given Israel's current situation. And I'm so proud, and Keira and I, we worked with this Rafi, and in our small group setting, and he comes in and participate in our monthly meeting, and a very enthusiastic and energetic person, and you don't want to miss a conversation. And so please join us next week, November 14th, 11 a.m. Pacific time. Next slide. So I will be sharing the video. Let me make sure it works. There you go. Okay. So hopefully you can all hear.
My preemie experience, already having gone through the trauma of infertility and already having that, at first I thought it was guilt, but it was shame. It was, I am not a good mother. I can't even get pregnant, first of all. Now I can't stay pregnant. Now I don't know my babies.
The trauma, it begins at delivery and then it just continues throughout until you get to discharge. And then you're processing.
As NICU providers, to take on all that emotion by someone, you'll just be fried by the end of the day, right? But leaving it absent and not addressing it doesn't allow for very good family-centered care. And I think a lot of it relies on communication.
Personally, after I gave birth at 24 weeks, I felt such guilt that I failed the boys, that I was like, now they're in the NICU, they're where they belong, they're with the people who know how to treat them, and they don't need me. I was lucky enough to be in a hospital that had a very strong family-centered care plan, who, before I could even verbalize that, said to me, you're going to change diapers, you're going to take the temperature, you're going to feed them, you're going to hold them. They need you. And I needed that to know that, I was supposed to be there.
After that first month, one of the nurses said, she said, have you held Avery today? And I haven't held Avery ever. And she said, oh, well, we're just going to make that happen today. And I was like, oh, I don't know if I can do that. But she said, we can do it. We're going to do it together.
Simply asking how my day was, or having a conversation with me that has nothing to do with the NICU or babies or monitors or beeping meant the world to me.
In any kind of an ICU situation, your relationship with your partner is at its most fragile, because you're both going through the hardest time of your life together with your child that you both love more than anything.
And I think another concrete thing that's super important that often gets left out, that our family experience, is not having adequate discharge planning. You go from having this like super high intensity experience to sometimes going home from having had a one-on-one nurse to being alone with your child, just saying like, hey, it's a big change to go home. If you have questions, this is where you call. You're going to have questions. That's okay. You know how to do this, and it's scary. So I think, just kind of naming that for families and helping people understand that you can be a good parent and be scared.
For NICU parents, this is again a life-altering event, that in the NICU, we are there because we have to, because that's our kid. We are resilient not because we want to, but because we have to. At the end of the day, as NICU providers and NICU teams, that you could go home, you could change jobs, you could do whatever you can. And again, not to say you don't care, because I know you absolutely care about your families and your kiddos. For us, that's our whole life.
There's that video from FCC Task Force, first webinar that we put together and asked the family partners and how do they feel about it when they get the family-centered care delivered, or why we need to do it. We asked them in a panel discussion. So that's the end product of that webinar. Thank you, Keira, for participating. Okay, so next, we learned about the educational webinars. Yeah, it's a continuing, and we already have a speaker set up for 2025. So the next step, we are doing it in the FCC task force, is educational webinars help create awareness, but it's not going to help us to keep the momentum going. So in 2023, we created this small group QA model. So we recruited interested centers to join the small QA collaborative work. And initially we had 34 centers joined, and slowly we lost few centers, and finally we had like a 22 solid centers. They really wanted to do something about their family-centered care practice. So they joined the collaborative, and we created a smart aim and wanted to increase the percentage of NICUs with the Family-Centered Care Committee and Family Partnership Council in 1 year time period, from baseline of 18% to at least 28%. Next slide, Kira. So it's the same Pareto chart that I'm showing here. And so once we created the aim, then we asked them what are the challenges, and which are listed here on this slide. And so based on those challenges, we created a key driver diagram. I mean, any quality improvement work that we do, you have to create a key driver diagram focusing on challenges and change ideas and how to work on improvement. And so that's what we did. So we created this barriers. We found the barriers and forming the FCC committees. Next slide here. So we created a key driver diagram focusing on 4 categories, like a senior leadership commitment and education about FCC, and how to improve the family participation, how to improve or eliminate the barriers for staff participation, and we come up with the change ideas. And we share the key driver diagram at the centers so they can modify based on their center's need. And so we were able to show the improvement. Next slide, Kira. We were able to show the improvement of from 18% the baseline to end of year in December to 59% of the centers, able to form the Family-Centered Care Committee and improve their family-centered care practices. Next slide. So it's the poll question. Please take a few minutes and answer the poll. That I think is the poll number 5. So do you collaborate with your family partner, or do you have a family partnership council or family advisory council in your NICU? I'm just going to look at the responses. So far, we got 187 answered. And so I will give a few seconds, maybe a couple more seconds. So one more response, 188 answered. So 114 have, okay, wow, that's wonderful. So 114 of you answered that you have a family advisory council or group of NICU parents support current NICU parents. That's wonderful. Thank you for sharing that. And 73 centers, you don't have one. So join the task force so we can make that happen. So that's our goal. Okay, thank you for sharing that. And with that, I will share what we did in our small quality improvement and collaborative work in 2023. So we asked the same questions for the Family Partnership Council. So what are the barriers in forming the Family Partnership Council? So Family Partnership Council is majority of them veteran NICU parents. And so they are solely family partners driven committees and council. And you can have occasionally healthcare partners like FCC chair and medical directors could be part of the team, but it's a majority of them are family partners. So as you can see, 25%, that is 1/4 of the centers, they listed all of them as a barriers. So what are those? So families unable to join the meetings, unable to recruit the meeting and recruit the family partners, financial factors, lack of staff time, lack of leadership buy-in. And so all those factors they listed as a common barriers forming the Family Partnership Council. So what we did is we put together a webinar on focusing on this topic, and we invited a few local family partners and national family partners and shared their resources. And next slide, Keira. We improved the percentage of centers with the FPC committee, like FPC, the Family Partnership Council, from 18 to 45% in 1 year. So I just wanted to mention that we did it in 1 year time period. If we continue doing this work, and I think we can get to the 100% goal. So with that, I will pass it over to Keira to share the framework of the family involvement.
Thank you, Malathi. I always love seeing those the graph and the chart to really see how impactful this is and how it doesn't have to take forever to see some change. So the Institute for Patient and Family-Centered Care has a framework that looks at 5 levels of family integration. As you can see here, level 1, where you have families complete surveys or other evaluative activities like focus groups. Level 2 is where you have the Family Advisory Council. So they're serving as a resource to the QI team. Level 3, families participate as occasional reviewers and consultants during an improvement project. Level 4, families participate as active members of improvement teams or may serve on unit-based task force and committees. And then, of course, level 5, where we have families as co-leaders of improvement initiatives. And that was something that that we really take to heart at the task force, is making sure that the family partners are not just asked for feedback after things have been decided or done, but we really are in co-leadership positions. And I think that's just one of the ways that the task force models that, you know, family-centered care isn't just at the bedside, it's for every level of healthcare. So one of the other ways that we, in 2000, sorry, I just had a little brain issue there for a second. We decided to change the structure where we had the small group discussions or small group with leaders that were family partners and healthcare partners and working specifically with those individual centers. And we decided to move it to a monthly office hours format, which has been really successful. And I think we've had just incredible engagement, very deep discussion. We always have it facilitated by a family partner and a healthcare partner. It is topical. Everyone is invited to participate. It's not a presentation. It is a discussion. It's where we're brainstorming strategies to overcome these barriers. You know, we're hearing from folks who have been really successful in their centers, and we're hearing from folks who are struggling and getting that encouragement and those ideas. These are completely free, so we would love. You know, I've already seen some of the questions that are being popped in for us about how do we get started. And this is a great place to get started. Join the task force, join the small group, the office hours. It's a wonderful way to network with your peers. And now I'm going to let Malathi talk about what we're really doing this year, that over the next year, that's super exciting.
Yeah. So as Keira mentioned, in 2024, we started doing this monthly office hours. In addition to that, and we don't have a way of measuring how the center is performing a family-centered care. So there's no benchmarking, like comparing from one center to other centers and how they are performing the FCC. So we put together collectively with the family partners and healthcare partners and a survey to assess the family-centered care practices. So you're going to watch the video about that survey and why we did it and what are the components of the survey and why your center needs to participate and to complete the survey. I'm saying this survey is not a 5 minutes question and answer survey. It is a very comprehensive survey, and it captures 7 categories of family-centered care practices. So it takes time. So we do have a simple way of how you can do it. Like if you printed the PDF copy and sit down with your team and then just collaboratively answer, then you can transcribe the information to online REDCap survey. So you have opportunity for your team to join us and then being a part of the interview, so we can hear your challenges and we can offer some potential solutions, and we can find a center similar demographic and similar acuity, and you can collaborate and you can collaborate with them and then learn from them. So that's the goal of this survey. So I'm going to share the video that we put together. It's the 5 minutes video, so you can understand more about that. I'm clicking the right one, not this one. Okay. Oh, sorry about that. Let me get to the right screen. Still not getting me there. Okay. Okay. Here we go.
Force is conducting pioneering work in family-centered care by developing a tool that will allow NICUs everywhere to benchmark their FCC efforts and performance. Through a comprehensive REDCap survey created in partnership with our Executive Council of Family Partners and Multidisciplinary Healthcare Partners, we are collecting robust data on 7 categories of FCC. These categories include NICU framework and infrastructure, family support, family integration into care, family integration into QI and processes, NICU environment, staff education, and balancing measures. Your participation in our NICU FCC measures survey directly impacts the promotion of FCC as a culture and standard of care. We don't want NICUs just to say they are practicing FCC or that they're good at FCC. We want to be able to demonstrate their performance in a standardized and measurable way, which allows us to improve family-centered care across the globe.
For successful survey completion, we recommend that you print a PDF of the NICU FCC Measures Survey using the link we'll provide. Next, collaborate with your colleagues to complete the survey on the printed PDF. Then transcribe your answers into the online version of the survey using the original link, which can be saved along the way in case you need to come back later. We are piloting this measuring tool and need your feedback to improve. After completing the survey, please share any comments on how we can refine our project to better optimize this questionnaire and capture FCC in the NICU. Once the survey is completed, you'll receive results automatically and will have the option to review them with FCC Task Force leadership. You'll also have the opportunity to collaborate with other NICUs to join topic-specific quality improvement work. Our Executive Council of Family Partners will share why it's imperative that your center participates in this benchmarking study.
Providers and clinicians in the NICU should participate in the survey about family-centered care because your insights are crucial for understanding the current level of family engagement and also to identify opportunities for improvement. As a mother of micropreemie twin boys and an advocate for nearly 2 decades, I can attest to the tireless work of hundreds of families dedicated to advanced family-centered care. And yet, family-centered care is not just something nice to do by the families. It is actually grounded in science, and it serves as a cornerstone for both quality and safety in healthcare. By completing this survey, you will help illuminate the role of family involvement in NICUs and highlighting the invaluable contributions families make to the care environment, ultimately fostering stronger partnerships and better outcomes for all.
A commitment to family-centered care is at the heart of every great healthcare provider. Your expertise and experience are invaluable. Please take a few minutes to complete this comprehensive survey. Your insights will help us understand the real impact of family-centered care and drive meaningful improvements. The results will be crucial in shaping the future of patient and family-centered care and ensuring that every family like mine receives the best possible support. Join us in making a difference. Complete the survey today because every family deserves the best possible care that we can provide.
By participating in this survey, you are supporting parental mental health for families in the NICU. Family-centered care includes supporting families by providing screenings for mental health, access to counselors, referrals to counselors, and peer support, all of which are so crucial for the long-term health and outcome of the baby and the entire family.
Family-centered care improves the patient's and family's experience with healthcare, reduces stress and conflict, and improves not only communication, but the health of babies. Please take a few minutes to complete this comprehensive survey to help us understand the impact of family-centered care and how meaningful quality improvements can enhance the future of patient-family support and care.
Families like mine are asking all of you clinicians and healthcare providers to take some time to fill out this survey. Share your thoughts, ideas, successes, and barriers, not just with us, but with your colleagues around the world so that we can take family-centered care from being a checkbox to the gold standard of care for our families.
Please take a few minutes to complete this comprehensive survey today. Thank you for being a unit that understands the importance of family-centered care. The NICU environment that family-centered care creates is so important to these families. This support is so crucial to these families having a positive NICU experience. Thank you again for being leaders that are bringing the highest level of family-centered care to these deserving families.
Thanks again for supporting your families. We know that family-centered care is so important to the success of the family and the success of the baby in the unit. And we thank you so much for your partnership and look forward to collaborating.
Okay, so there's the QR code on the screen, so you can either scan, and I think Erica put the link there for you to participate and to receive the actual survey. So we are opening up the survey to only the medical directors and clinical leaders, or whoever is a champion for the FCC. And so we wanted to receive a response, one survey response per center. So we don't want to distribute this widely. So we just wanted to double check and making sure one response per center. So that's why sign up and receive the survey and complete and share that information with us. Thank you. And with that, the next slide is, do we have time to go through the survey quickly? Do we have time, Kelly?
Okay. Absolutely. Yes, so, we have plenty of time. I came on because it seemed like y'all were pausing. So I was like, do they, okay, what do you help? So
I'm so excited to share. Yeah, I'm so excited to share we started distributing the survey end of October. So within a month, and we received a response of 48. I just checked this morning. It's 48 responses. So it is coming in. So I'm so excited about that. And so this slide is actually showing a response of 31 centers, and because I pulled this data a few days ago. So 31 responses, and 50% are from level 3 NICUs and 40% level 4, and 10% of level 2 NICUs participated in the survey. Next slide. So the great news, most of them, except 2 centers, encourage family presence at the bedside whenever they want, and no matter the time of the day, which are great news. And 2 centers, we can collaborate and we can even make them change their policy. So that's the next step. Next slide. And this one, the same questions we asked them. Do you have a family-centered care committee or a group that oversees the family-centered care activities? So we heard 50% did not have out of 39 responses. So it's almost similar to the what I found in 2021 survey. So there is a work for us to do in this area. Next slide. So this question is, or do you collaborate with family partners? And 20 centers out of 38 actually integrate family partners with former NICU parents, and which are great. So I would just wanted to see the other rest of the centers to include their family partners in their work. So that's the goal of this task force. Next stage. Next slide. Okay, so we are in a hand-to-hold conference, mental health conference. So if you are not talking about this, the survey response in relation to the mental health professionals, it's not right. So I pulled the data about mental health professionals. Does your NICU have on-staff psychologist or mental health counselor? So as you can see, 75% of them, that is 29 centers, they don't have one. So only 10 centers. My guess, I haven't looked at the data. My guess is they're all level 4 NICU, the children's hospital. So probably they are level 4 NICU. They already have a psychiatrist and department. Everything is set up. So they probably utilizing the psychologist and psychiatrist through that network. So only 10 centers have mental health professionals in their NICU. So it's crucial to have the mental health professionals. So we have a slide that we are going to share. The National Perinatal Association actually put together article on neonatology today, last month. It's on their website. So you can go on the review and why it's essential, why we needed a screening. So this is the result of our perinatal mood and anxiety disorder screening. So how many NICUs are doing that screen as part of the routine? And only 18 centers, like 48%, they do this screening, and 19 centers, that is 51%, they don't have any standardized way of screening their families in the NICU. Next slide. Keira. So this is the position statement. I pulled it from the NPA website. And so you can actually see the recommendation is routine screening of pregnant and postpartum women for perinatal depression has been recommended by several organizations, including AAP, ACOG, and American College of Nurse Midwives. And so all those organizations are recommending to routine screening, but it's still not happening. So how do we make that happen? So that's where we have to brainstorm and then we'll collaborate with the other organization and see how we can help the centers to form those, implement those things. Next slide. So we asked them about a local peer support. Only 7 centers have a local peer-to-peer support. We understand it's time consuming and difficult to train and recruit families to be a mentor. The next slide. In that situation, it would be wonderful to connect with the National Peer Support Organization, like Hand to Hold or other organization in the NPN. Are we doing that? No. 52% do not utilize the National Peer Support. Only 35%, they give the handout, but it's a family responsibility. Think about it. Is there a families, they come to the NICU, they are traumatic and trauma and everything going on. Do they have a time to pick up the phone and then talk and connect with this peer support? So there should be a way that we can create this someone from the hospital to be in charge of connecting those families to the national organization. So is there any way we can bridge the gap. That's what I wanted to invite Keira and even Kelly to share their thoughts around these preliminary data and potential solutions and how these community partners organization can help and support these local NICUs.
Yeah, absolutely. Well, I think, that one answer where it says, yes, they provide the information, but it's the family's responsibility to connect. I think that is why it's so critical that you are able to partner with organizations like Hand to Hold that have peer support in the unit where they're coming to the family. Because like you mentioned, Malathi, um, you know, parents may be given information, which is great. I'm glad it's given to them, but there may be a hesitancy or a fear about reaching out for help. But if that help is brought to them, it's just different. Do you agree, Kelly? You have years of experience in this area.
I strongly agree. And I think a lot has to do with the bedside nurses as well. I think if they're recommending it, I mean, I just know that we have typically very strong relationships with them and trust them, along with our social workers. So if it is being recommended to us, and it's made easy for us to access, I think that just any barrier that you can remove, we know that when they have to be proactive and go and make that first phone call and find the support and ask for support, that can tend to be very difficult. But a lot of families do, find us through the app. They find us through our podcast, and they are seeking out peer support. So a lot of families are looking, but we would like for the hospitals to make those recommendations so the families are confident in finding us.
Yeah, absolutely. I mean, just being that facilitator, I love that they're providing the information, but taking that next step to actually help make the connection, I think is really critical. And that's the other thing too, is just recognizing that peer-to-peer support is an evidence-based, tool to support mental health. And we know this. We have the research that backs it up. And so making sure that you are just taking that extra step to, well, here's this information. Would you like me to have somebody call you or text you, so that the organization is reaching out to the family and being able to get that permission to share the contact information, I think is a step that is not too time consuming to take.
Great. And next slide, Keira. I think your call to action slide. There you go.
So, if there is one thing that you take away from this, even if it's just one thing, please join the task force. It's a great first step to start to learn about what the task force is doing, because everything that you learn, will benefit the work that you're doing in your unit, and you're finding this wonderful network of support and encouragement from your peers in the field. We have also found that in our surveys that those who share the information with their staff and their colleagues, maybe one person attends the webinar and then says to everybody else on their team, hey, you need to watch this webinar or listen to this webinar on your commute in. They're the ones that are seeing more change, more positive impact in delivering FCC in their units. Again, we would love for you to take that survey. I'm so excited to hear that, when Malathi shared some of these results that we have already, it was 31 responses, and now we're already up to 48. So I'm really interested to see, does the data change in what we're seeing, or is it going to trend the way that we've already seen from the 31? So as much information as we can get from as many centers as possible is what's going to help us learn how to do it better together. Again, share and listen to the webinars, share the quarterly newsletter. As soon as you join the task force on the website, you'll be added to the listserv. And again, those small group office hours are just so meaningful. And I just can't say enough about how much learning, and again, just how supportive this community is, that everybody really is looking to improve. and looking to mentor those that are just getting started, which I think is just a beautiful part of our task force. So we did want to share this and to see if there are any questions. I'm gonna go back and see. Okay. So what is what do you think the biggest barriers are to family-centered care in the NICU? We kind of answered that with some of our surveys and the chart that you showed, Malathi. Can you have FCC policies without having a parent group that meets regularly? Or do you, or do you need parent input in order to have true FCC practices? You need parent input to have true FCC practices. It's just, there's no way around it. Otherwise, it's not family centered. It's physician or healthcare team centered.
Yeah, it reminds me, Keira, the very first time I heard you say nothing for us without us. And that kind of became our motto of wanting to ensure that the family voice, the parent voice was always a part of any policies being set and new practices and standards of care. So, shout out to the NICU Parent Network and the FCC task force, but being involved in the review of new standards and practices and having parent input in that is so powerful.
Yeah, and particularly including them in the development from the beginning, because then you're going to get it right from the beginning.
I just wanted to add to that question, Keira. I just guess it is going to be hard, and you are not going to include all the family partners in the beginning because you have to face several challenges in your hospital level and everything. But asking their feedback, and I think there was a question about what are the best way to ask the feedback. There is no best way, just even simply informal way. You can just talk to a few families and then hear their feedback and then see if you can modify the practice. And so all these things started in my local NICU because I attended that one family partnership council that heard the family voices. So that's the thing that changed. We go back and update the birth mom after delivery. Hearing those stories that made the change, that's a standard of care for us. So we go back and update the mom. The baby is in the NICU, so the baby is on CPAP and doing well, and we will come back and talk to you in more. That's it, 1 minute. We'll just go and then update. That's our standard of care. So unless you hear from the family, you don't know what you are delivering is true family-centered care or not. So include them. Just informal way, ask some feedback, then formally invite them and include them as a part of the committee and subcommittee, then come up to the leadership team and quality improvement, and you can move their ladder. So it is going to be an informal level 1 in the beginning. So you cannot expect them to be a level 5 co-leading at the beginning.
No, right, absolutely. There's one question here too, Malathi, that says, what should FCC services or benefits consist of?
FCC services benefits consist of.
And I'm guessing this is kind of asking, like, what does it really look like to be delivering family-centered care?
So if they are curious, we gave our local family-centered care work in one of the webinars in FCC task force. So I believe it's September of 2022. No, not September. September, Alex gave the talk. I believe July somewhere. So it's all in our database. So I shared our local unit FCC practices starting from antepartum to the NICU and discharge and beyond. So you just watch those webinars and just learn. It start from somewhere. So low hanging fruit and recruiting a passionate FCC advocate. And start with one person, you and other person, just joining and then talking about where to start and how to start. And then you can get to the leadership and then collaborate and bring everyone on the table. So that's how we started, and that's the direction I would just encourage you to go and then listen to the webinar. And our email address at the end of this slide deck. So reach out to me. I'm happy to help and support in any way I could. So starting with this, attending the webinars and how the centers are performing, what are their challenges, and reach out to them and connect with them. That's how we can make it better.
I don't know if Morgan is on and watching, but if she is, maybe she could pop that into the chat, the link to that video. But what I would also say, Malathi, is if they take the survey, they will see all the things that are being measured.
I was going to say the same thing, Kelly.
And that's your roadmap, because that we're measuring all the different aspects of what is considered family-centered care. And so you're going through that survey and you're like, oh, we don't do that. We don't have that. So then you have some goals to work towards.
That's absolutely right. Yes.
See, there's a question. What is the best way for a NICU grad parent to get involved in this work? Again, join the task force. It's a great way to get started. And please email me directly. My email is here, and I would love to have a chat with you and just kind of hear more about what it is that's interesting to you, and find out where you are, because there may be a local group that we can get you connected with, or if you're because there's so many different ways to be involved. You can be involved in that one-on-one peer-to-peer support by linking up with like Hand to Hold and becoming one of their trained mentors. Other organizations around the country have other ways for mobilizing NICU grads who want to give back. And if advocacy work or quality improvement is more what you're looking into, then yeah, we can put you to work through the task force and through NPN as well.
I just posted the webinar YouTube link. So if you subscribe to our YouTube, and you can get all the video link too. So it's in July 14, 2022.
And I want to thank everybody in the chat that are just saying how wonderful the task force is, because I happen to agree, and how wonderful Hand to Hold is. Which I also agree.
Well, I will say, two very incredible women on leading this discussion today. Few have done more, honestly, for the advancement of family-centered care and ensuring that the parent voice is heard. Malathi, I'm just blown away. I told you earlier of what has been accomplished in just 3 years, and how many members we now have. And we are truly building a coalition, a true force. We will no longer be able to say, oh, we have family-centered care because we have a breastfeeding support group. And I've heard that. And I think that's wonderful. We need a breastfeeding support group, but we need so much more. There are so many layers, and we need buy-in from the leadership and from all of the NICU professionals. And we are making great strides. And so I'm just proud that Hand to Hold is part of the Family-Centered Care Task Force, a founding member of NICU Parent Network, and so grateful for your work and for your time. I know that Malathi is actually about to be picked up by her Lyft service to shuttle her off. She's going to be presenting at a conference tomorrow, I believe, in California. So thank you for your time, both of you. It's been an incredible 2 days. I hope everyone has many takeaways. I know I do. One of the staff said earlier, it's a good conference when you cry in every session. And I will say, I have had to battle back tears, not just the content, but just the pride that I have in seeing the advancement of the care and approach of family-centered care, but a focus on the mental health of the NICU parent. And that's why I started Hand to Hold, knowing that my son got the very best possible care he could possibly get as a 24-weeker, but I fell through the cracks and just not even understanding the impact of preterm birth, a traumatic birth, my risk for postpartum depression, anxiety disorder, PTSD, all of those things. And I just think there's such a wonderful awareness now in so many advocacy groups and support groups. And just encourage everyone who's attending, if your hospital needs support, if your families need support, please connect with Hand to Hold. We would love to help you better support your families, your NICU families, and your bereaved families. So thank you again for everyone who spoke, who participated, who took time to participate in the chat. It was such a lively discussion. I just felt like we had so much more interaction than in previous years, and lots of questions, and just thank you for your vulnerability and your participation. I wanted to remind everybody we did record the different sessions. They should all be available next week. We're working on that behind the scenes, and everyone's going to be getting conference surveys. We do want your feedback, your constructive, critical feedback, and give us ideas for speakers and topics that you would like to hear. But just thank all of you, and wish you all well, and have a safe flight. Malathi, thank you for your time, and congratulations again on being our NICU Hero Unit Award winner. El Camino Health is setting the standard for family-centered care, so we were so glad to be able to recognize you and your amazing team today. Thank you, everyone. Have a great night.
Thank you.
You, Kelly.
Bye-bye. Thank you.
Bye.